Welcome to the Learn True Health podcast. I'm your host, Ashley James. This is episode 49.
You know, I always like to get to know people before I get started. So just out of curiosity, when did you, how did you get into this, the podcasting thing? What's sort of your background?
Well, so I was raised in Canada. I'm from Toronto, and
Okay.
I worked in sports rehab. I was a massage therapist and a physical therapist assistant, and then I became a trainer and master practitioner of neuro-linguistic programming, timeline therapy, hypnosis, and coaching. And so then I jumped into sort of the mental emotional side of things. I mean, especially after seeing for so many years people who have the same injury, if they had a very negative outlook on life, would constantly re-injure themselves, versus people who had a positive outlook on life would heal very quickly. And so after seeing that, I really saw that there was more to healing than physical. And I loved working in physical medicine, but the mind is where I became really obsessed and excited. And so I dived into that, and then I got into energy work, Reiki master. And it really it's been my journey. My mom died in my 20s, and so did my dad. And I struggled with hormone issues and weight issues, and obviously emotional issues that came out of that. And so what I saw was that health is absolutely is mind, body, and spirit. So mental, emotional, physical, spiritual, energetic. We have all these different bodies, and they overlap. And so we have to address all of them. And it's interesting, the man that I interviewed about raw cannabinoids, he has this spiritual belief that cannabis was is something from the angelic realm. Which, is, getting into that spirituality of it. I never thought of it that way. But I got into supplements and worked with naturopaths in the last 5 years. I've worked with naturopaths and supplements, and then I've always wanted to do a podcast, and it sort of became the right time. And so we launched it in March, and it just took off, and we have well over 100,000 downloads. And like I said, for over three months, we were in the number one spot in health and new and noteworthy. So, I love helping people find answers.
That's great. That's awesome to hear. And you're right. I think it's all elements combined, which is something I'm actually not taught. And nobody is taught in medical school. The focus is very much on the physical, but there's so many other factors that contribute to it, to health. So that's great to hear.
Excellent. Well, we're gonna officially start the interview, but I'm looking forward to hearing a bit about your story, how an MD can go from medical school to where you are, and I think that's fantastic where you are, by the way. I really believe you're doing some great work, and you must feel like you're on the front lines, like a pioneer.
Yeah, and there's always bumps along the road when you're on the front lines. Yeah.
Sure.
So, and actually, just a quick correction. So I'm a DO, not an MD.
Oh, well, even better. Yeah. Even better. Thank you so much for correcting me, because I have a much greater respect for osteopaths. So excellent. Well, my next guest, and I always say I'm so excited for my next guest, but I truly, truly, truly am. I really am excited. Dr. Rachna Patel is an DO, which is an osteopathic doctor. Did I say that right?
Yep, you said it right.
Fantastic. You are an osteopath, and you've gone from medical school to being the medical marijuana doctor. You are helping people heal through the medicinal effects of marijuana. And I am so excited for you to be here today to open our eyes to we really need to open our minds, because so many of us still think marijuana is, and in many states and in many countries, it's an illegal substance. And luckily, though, because there's so many healing benefits, you live in a state where it's legal, and not only is it legal, patients can use it for medicinal purposes. So you're here today to open our minds and educate us on the healing properties and how to use it, and why and when someone would want to use it. But before you teach us all of that wonderful information, I'd love for you to share with our listeners a little bit about you and how you became the medical marijuana doctor.
Sure. Well, first of all, thank you for having me on your show. I very much appreciate it. So how did I fall into this field of medical marijuana? So my background is that I went to medical school out in California, graduated in 2009, and my background is in emergency medicine. And there was a point while I was training where I was just surfing on Craigslist, and I happened on an ad that said medical marijuana doctor needed. And that was completely news to me. I had no idea that this field ever even existed. So it started as just curiosity. And little by little, I started looking more and more into medical marijuana, its benefits, started reading all the journal articles that were out there. And I spent about a good year doing this. And then I decided, okay, well, I have this research information, but I really need to know clinically, what is this medication doing clinically in patients? So I ventured out back again to California, and ended up working at a medical marijuana clinic where I gained tons of experience treating patients with medical marijuana. And, there were a lot of cases where it took me completely by surprise, in cases of patients with epilepsy, in cases of patients with multiple sclerosis, even with chronic pain when opioids just weren't cutting it for the patients. And, it seemed like medical marijuana came to the rescue for them. So, and then eventually, I ventured into opening my own practice because, let's just say in California, the medical marijuana field didn't get off on the right foot. A lot of doctors were opening up practices where medical marijuana cards were, essentially these were just mills where they were just handing out cards. And so I definitely wanted to do my work with more integrity. And I did also see a need at the same time that patients were looking for more information. They wanted to know, well, how do I use this? How do I avoid the side effects? So that's when I started my own practice, again in California, out in Walnut Creek. And I've been doing this since 2014 now.
Wow, that's fantastic. I have a friend who suffers from a autoimmune disease that leaves her in crippling pain that she literally can't move, and the pain leaves her mentally unable to think or focus for days, even after the pain has left her. She started using Rick Simpson oil and medicinally, and that is the only thing that has been able to help her gain control of her life again. She feels as though she's healing from the autoimmune disease using this Rick Simpson oil. Could you explain how that's possible?
Sure. So and actually, I'm not surprised by the results that your friend is having, because marijuana actually has very potent anti-inflammatory properties. And I've had quite a few patients with autoimmune conditions like multiple sclerosis, like arthritis, like Crohn's disease, like ulcerative colitis, that have very much benefited from using medical marijuana. Now, if we want to get down to the science of it, and there's mainly three ways that marijuana exerts its anti-inflammatory effects. Most of this is based on research done in mice, but the three ways are that, one, it actually causes apoptosis, or what's known as cell death, of the immune cells that are causing the autoimmune attack. Okay, so that's one way. Now, the second way is that it suppresses what's known as cytokines, the production of cytokines. Cytokines are pretty much these signals that are sent out by immune cells to say, hey, we need to exacerbate our inflammatory response here. So we need more of you guys. It recruits more sort of troops in the inflammatory response army. So what marijuana does is that it just suppresses these signals. The other thing that marijuana does is that it activates T regulatory cells. Now, specifically, regulatory cells, they make sure that the body doesn't respond to self-antigens, and it prevents autoimmune disease. So we have a good bit of information on the science as to how marijuana is acting as an anti-inflammatory agent.
Wow, incredible. And what about for those people who are suffering, but maybe have never experienced marijuana and they're afraid, like you said, of the side effects? How can they benefit from the positive anti-inflammatory qualities and the other qualities that you just mentioned without getting high or feeling out of it or out of control?
Sure. Okay. So this is definitely a concern that a lot of patients bring into my office on a daily basis. And it comes down to a couple things. One is are you using the right combination of chemicals when it comes to marijuana? THC is the psychoactive compound in marijuana. So taking large amounts of that will cause psychoactive effects. And also, you want to take, so when it comes to medication, there's a therapeutic range and then there's a toxic range. And much of what we see in the media is people who have been abusing marijuana in the past, and they've been putting so much in their body that it's now at toxic levels where they're experiencing side effects like paranoia, like hallucinations. But the goal with marijuana is to take, I believe in minimal use. Okay, so just only take the amount that's needed for the medical benefit, so that way you won't get the side effect. Okay, so the first part of it is, like I said, the combination of chemicals. The second part of it is dose, which I just talked about, where you don't want to overdo it. You want to just use just the right amount. And then the third part of it is also how often you're using it. Again, you don't want to be overdoing it. So all three of those components factor into whether or not you'll get side effects.
And as far as taking it, I think everyone knows, like, okay, there's a joint, you can smoke it. But what kinds of ways, because, does smoking marijuana cause potential lung problems in the future, just like, because it's a carcinogen when you inhale smoke? Do you recommend other ways of ingesting the cannabinoids for the healing properties?
Sure. So I typically sway my patients away from smoking marijuana, and that's for a couple of reasons. So long term, it does put you at risk of infections like a chronic bronchitis. It does also put you at risk of conditions like COPD, chronic obstructive pulmonary disease, which is, if you've ever seen patients walking around with oxygen tanks, that's what they have, is COPD. So now, there are other options available. There is a form of inhalation called vaporization. You can also ingest marijuana. It's basically food products. A lot of them tend to be sweets, but nowadays they are making healthier and healthier options. So that's a good thing. And then there's also topicals that are available too. So that you can apply directly to the skin to the affected area.
What about tinctures? What are your views on tinctures?
So tinctures are another route of administration of marijuana that I actually forgot to mention. And those are typically used under the tongue. Those are a great option as well. I feel like when used appropriately, edibles and tinctures are a good route to go.
Excellent. So
again, a lot of it, sorry to interrupt, but a lot of it depends on your medical condition and what method of use is going to end up being most appropriate.
Yeah, why don't you share some stories with us of certain like common conditions and how you recommended they use medicinal marijuana, and then what was the end result?
Sure. So we can take the example of arthritis, for instance. When I have patients come in that have just knee pain, it's just one knee. So in that case, what I typically recommend is, you can start off by using a topical. And topicals, the effect lasts anywhere from 4 to 6 hours. So the downside is that you do have to keep on reapplying it. But the upside is that you don't have any sort of the internal effects from the marijuana. So you don't get any sort of psychoactive effect. You don't get any sort of drowsiness from it. Now, if say I had a patient with arthritis that came in that said they have multiple joints that hurt. Well, in that case, using a topical isn't as practical. So I'd recommend using something internally, like an edible or a tincture, for instance.
Excellent. And is the pain decreased only because of the anti-inflammatory properties, or does cannabinoids, link to pain receptors? Like, what are the other sort of science bits of information that explain why marijuana is so good at decreasing or eliminating pain?
Okay, so that's actually a question that we don't have much information on at this point because the research is limited. And so there are some theories, but we don't have definitive answers. Again, a lot of what I said was based on research done in mice, but we don't know what's specifically going on in humans. But what other theories are that marijuana plays a role in the pain pathways and interferes with the signaling of pain that's transmitted. So that's one of the other possible theories as to what may be going on. But I think the stronger theory is that a lot of it has to do with a reduction in inflammation.
That's fantastic. So what conditions that are highly inflammatory conditions have you seen results in, and what were the ways that you like specifically told them to take, like what's the dosage and how did they take it, and how long did it take for the pain to go away?
Sure. So dosing. So in general, just a comment about dosing. Dosing varies highly from patient to patient. I haven't found that there's one dose that works for one specific medical condition. And a lot of that may have to do with the fact that marijuana is a fat-soluble medication, and we all metabolize fats differently. So there isn't really one dose. But in terms of your other question about inflammatory conditions that I've treated, so multiple sclerosis is one. And actually, let me go into the science of it. It's really interesting.
Cool.
What happens with multiple sclerosis is that we have these immune cells in our central nervous system called microglial cells. And what marijuana does is that, and actually, let me backtrack a little bit. The microglial cells help to protect your brain against injury and disease. But specifically in the case of multiple sclerosis, they're actually attacking the sheath that's insulating the nerves. And what that does is that it throws off the signaling of the nerves. So it's almost like it's all over the place. Now, what marijuana does is that it causes the death of these microglial cells in the case of multiple sclerosis. And it also inhibits the activation of these microglial cells. Another way that marijuana has shown to help with multiple sclerosis at the cellular level is that it inhibits the effects of astrocytes. So we have another group of cells that are part of the immune system that are known as astrocytes. And in multiple sclerosis, astrocytes secrete substances that cause inflammation. So the cannabis is inhibiting the inflammation by inhibiting the astrocytes. So that's how it works on a cellular level. But clinically, what I've seen is that cannabis helps tremendously in my multiple sclerosis patients by reducing any spasticity that's going on. A lot of times these patients are on a commonly prescribed medication known as Flexeril, which is a muscle relaxant. And a lot of times it's not effective in helping to control the muscle spasms, whereas they found that the medical marijuana is more effective in controlling the muscle spasms. It also helps these patients with tremors, any sort of weakness that they may have. So that's what I've seen clinically.
Wow, that's amazing. So we're talking about cannabis in general, but there's so many different kinds. Is there a certain, I don't know, strain, or is there maybe is it more like I'm sorry, I'm forgetting the terminology, but like sativa versus indica.
Mhm.
Is there a specific kind that is more effective at being anti-inflammatory, or CBD versus THC? Um, where do you recommend your patients, sort of what type do you recommend they go for?
So, in general, based on research, CBD and THC are about equivalently um, uh, anti-inflammatory. And in fact, what may be going on is that they're working together, working synergistically, is what it's called scientifically, to help reduce inflammation. And then CBD has more antispasmodic properties than THC. So, in the case of someone who has any sort of muscle spasms, they benefit more from using something that's higher in CBD as opposed to THC.
Now, CBD does not get you high, right?
CBD is not psychoactive, no.
Got it. So if someone got a tincture that was only CBD, it could help them with pain and inflammation and spasms, and they wouldn't get high.
No, I mean, it always depends on how much THC is in there, okay? And it also depends on how much of it you're taking as well. So overall, say it had whatever you purchased had a lot more CBD in it. And even if you overdid it, no, you would not get any sort of psychoactive effect from it. The psychoactive effect I found typically comes from the THC.
What other share some more stories? What other stories just completely blew your mind where you did not expect to get the result that your patient got?
Sure. So in general, my patients with fibromyalgia, which does have an inflammatory component to it. What was most surprising to me is that they were able to come off of their pharmaceutical medications and replace it with medical marijuana. That was something that I had never expected. I always figured, okay, medical marijuana would be a good adjunct therapy to what they're taking in terms of pharmaceuticals. But they would come back to me and say, I'm off of my medications, or that I've significantly reduced the doses of a lot of these medications, such that I'm now not experiencing side effects from the pharmaceuticals. So that definitely blew me away, where patients are able to come off of pharmaceutical medications, or they're able to reduce their dose significantly. And medical marijuana is taking the place of a lot of these other pharmaceutical medications. And it especially was the case in my fibromyalgia patients.
That is absolutely phenomenal. I have a friend who has two bedside drawers full of medications from fibromyalgia, and I know that she's been able to reduce some of her medications, and she does use medicinal marijuana. In those instances in fibromyalgia, do you find that there's like tinctures work better, or edibles work better, or do you recommend Rick Simpson oil, or what? Or do you just find that they have to experiment until they find the method that works best for them?
Yeah. So typically, what matters to me more is the combination of chemicals that they're using. The method of administration really ultimately comes down to personal preference. A lot of patients don't like that tinctures, you can taste the plant in it. Because it's what basically a tincture is that it's the chemicals in marijuana. It's extracted in either oils, alcohol, or vegetable glycerin. So you can taste the plant in there. There's nothing else no other ingredients in there to sort of cover up the taste. So that comes down to personal preference. What's important to me as a doctor is, are they using the appropriate combination of chemicals? Are they using the appropriate dose? Are they taking it with the appropriate frequency? And then also, I wanted to touch upon the fact as to why patients are able to come off of pharmaceutical medications, specifically opioids. Now, they've done research where they've given opioids along with marijuana. And what they found is that marijuana enhances the effect of the opioids. So you end up needing less of it, which makes it easier to either reduce the dose or just come off of it completely.
Amazing. Oh, it is so exciting what you're seeing, these results that you're seeing
Yeah,
on Facebook. Just a few days ago, I was scrolling through and I saw a video of a boy in full on seizure. It was quite scary, and the parent took off the boy's sock, and his whole body was just held stiff and shaking, like vibrating. And
yeah,
he was probably about 12. The dad was holding his cell phone, filming it with one hand. The other hand, he pulled off the his son's sock, rubbed a roll-on tincture on his foot, and very quickly the son stopped having the seizure. And it's a little video that's kind of going viral, I guess, about how effective medicinal marijuana is for children who suffer from epilepsy.
yeah.
How have you worked with epileptics, and what are the results you've seen?
Sure. I've actually worked with quite a few epileptics, and you know, in that particular population, I have found that they do need to stay on pharmaceutical medications. That marijuana alone doesn't cut it, but when you add medical marijuana to the already existing medications that they're taking, it helps to reduce the frequency of the seizures that they're having, as well as the duration of the seizures as well. So overall, that helps to make for a better quality of life, because you're now increasing the time where they can, sort of go about their day in as normal of a way as possible.
Wonderful. And how about cancer patients? Have you had any success or seen any success with cancer patients that have implemented medical marijuana?
Sure. So specifically with cancer patients, I have patients that I treat for side effects of chemo. So specifically nausea, vomiting, which leads to poor appetite. So medical marijuana definitely helps with that, specifically in terms of stimulating their appetite. They're able they have an appetite, and they're able to have, normal meals, which is a big thing when you're undergoing chemo. You need nutrition to keep up your strength. And cancer in and of itself is what's called cachectic. It eats away at your internal resources. So it makes it even more important to have nutrition in your body. Now, what I do want to touch on is a lot of information out there on marijuana being a cure for cancer. So at this point in time, having read the research and having treated patients, I would say that it's an unqualified health claim that's being made. There's certainly research at the cellular level, based on mice, that shows that marijuana works in several different ways to target cancer cells. But we don't have enough information to go off of to conclusively say that, yes, it does help to treat cancer. So I always tell my patients that come in that are looking to use marijuana as a treatment for cancer that marijuana is a good adjunct therapy, but to not get your hopes up in terms of using it as a treatment for your cancer.
And now for the emotional and mental problems, like people who suffer from high anxiety or social anxiety, people who have post-traumatic stress, which is becoming more and more apparent, that our vets are coming home with post-traumatic stress, and that there isn't, unfortunately, there isn't an effective system right now in place to help them. I know they're trying, but I cannot believe the amount of people I know with post-traumatic stress.
Yeah.
Have you worked with patients who have emotional, mental problems, and has medical marijuana help them to be able to function?
Yeah. So specifically, one of the most common conditions that I treat is anxiety. And I would have to say, with all the experience that I've had, that medical marijuana does do a better job of treating anxiety compared to pharmaceutical medications. I've also treated veterans that struggle with PTSD, and the marijuana helps them in several ways. So first, they just say that they feel more comfortable in larger crowds. They don't feel hypervigilant when they're in crowds. They also have fewer nightmares, so they sleep better. They're able to fall asleep. They're able to stay asleep. So it helps their overall functioning in society when you sort of take away these triggers that cause that anxiety. So yeah.
Excellent. Well, now you're in California. Are you licensed in any other states?
I'm not.
Okay.
I'm licensed only in the state of California.
So if a listener is not in California, they can't contact you for help, or do you have some services where you do telemedicine?
So, you know what I do for the patients that I can't help directly? I have an Ask Me Anything Wednesday on my Facebook page. So they can go ahead and post their questions. And though I can't give them specific medical advice, being that I'm not their doctor, I'll do my best to answer their question in terms of, what the research says, what I've seen in my own patients. So they can go ahead and do that. I'm always more than willing to answer questions.
I think that is just absolutely wonderful. I loved it when I saw that you had to Ask Me Anything Wednesday, that you're helping everyone, and I'm sure we could go into your Facebook page and read all of the answers, and there would be a plethora of great information. I'm going to make sure that the link to your Facebook fan page is in the show notes of this podcast, so all the listeners who want to go and learn more from you can absolutely get to it. Now, let's say someone has their medical marijuana card, they're in California, or they're in Colorado, or they're in Washington or Oregon. I think there's a state in the East Coast. I don't know. I'm like so West Coast, but I know there's a few other states that you can have medical marijuana cards. And in Canada as well. I know that there are certain provinces where we can have medical marijuana cards. So for those who do, and they're wanting to, follow your input and get some edibles or some tinctures or maybe something to vape, what kind of laboratory tests they need to look at? Like, how do they pick out of all the amazing amount of products out there, what do they need to be aware of on the label?
Sure. So now the important thing to keep in mind is that in a lot of states, specifically currently in California, laboratory testing is not required. It's being done voluntarily. I know for a fact that in the state of Colorado, the state has implemented standards for testing. So that's the first and foremost thing that you want to look into is the product that I'm purchasing laboratory tested. Now, that laboratory testing is important because, number one, it gives you the amounts of the different chemicals that are in the products. And that way you know exactly what you're putting in your body. Okay. Second thing is that a lot of times these laboratories test for pesticides and fungicides. That's important because, again, being in an industry that's not fully regulated, you don't know how much pesticides, how much fungicides the growers are using. We'd hope that they're using, if they are using these pesticides and fungicides, those levels are non-toxic, but you just never know. So you don't want to, it doesn't make sense to turn to something all natural and then all of a sudden be exposed to toxic levels of pesticides and fungicides. So that's the second thing. The third thing is that they test for fungus and bacteria. So anything that's not handled correctly could very likely get contaminated with things like E. coli, salmonella. Also, at the same realm, the marijuana plant itself is very prone to growing fungus. Okay. Now, the average person won't probably get sick from this fungus. Obviously, you don't want to put fungus in your body when you don't need to. So it is important to get it tested, make sure that it's been tested for that. But it's especially important for patients that have compromised immune systems. So it's not just cancer patients or patients with HIV, but it's also patients who are on immunosuppressant drugs. So these are patients who have inflammatory conditions and are, for instance, on methotrexate, for instance. Okay. So it does become very important that whatever you get is overall tested, but then specifically in these populations, that it's also tested for things like fungus and bacteria as well.
Interesting. Now, on your website, and by the way, I think Washington State, which is a state I'm in, mandatory testing. and I know of 3 growers that are
Hmm.
organic. Um, because I absolutely agree with you. It is, I've heard, I mean, I'm friends with people who either have been growers in the past, or friends who, I mean, it's a big industry now. So friends who are now working for growers, and the ones who aren't organic, I've been told there's a lot of chemicals they put on it, because of course they're looking to make money, and so the more they just want to douse the plants with as much
Yeah.
stuff as they can to grow a big crop and yield money.
Yeah.
Whereas, and they won't, there's certain growers that won't flush the plant, that won't, do the things that give it that make it healthy for the consumer. So I do know that there are 3, and there might be more, growers that do grow organic in the state of Washington. But yeah, if you can, as a patient, can hunt down those that use the least amount of chemicals, or the most organic process possible. Absolutely. Now, do you see a difference in quality between indoor grown and outdoor grown?
So, objectively, no. I mean, they both can have varying amounts of chemicals, cannabinoids. I do know just from basic knowledge that they do tend to use more pesticides and fungicides with indoor grown versus outdoor grown, but I'm not certain about that actually. This is an area that I'm not very knowledgeable about.
I've only heard from pot enthusiasts that outdoor grown is better. I don't know. It's also, I mean, what I've been told is it's also cheaper, because they growers use less, chemicals, so it costs them less, so then it ends up being cheaper
Yeah,
for the consumer. But that's speculation. I haven't like researched it or anything.
yeah,
Now I'm on your website and I'm seeing this great blog, and so I'd love to ask you a few questions.
sure.
You have this blog post talking about the dangers of mixing marijuana and alcohol. Can you go into that?
Sure. So, based on just a tiny amount of research that's done, well, first of all, a little bit of background. Both marijuana and alcohol are processed or metabolized in the liver. Some of marijuana is also metabolized by the kidneys as well. And so, when you put both of these substances in your body, and the liver only has limited resources, it's going to sort of have to figure out, okay, well, what do I process first? It's trying to attack 2 things at once. So the theory is that it tries to get rid of the more toxic substance first, and that would be alcohol, because alcohol does produce toxic metabolites. And so, what they found in this really tiny study that was done is that people who consumed both alcohol and marijuana had elevated levels of marijuana for a longer period of time. Okay. And so, essentially, what that means from a practical sense is that, I mean, I generally advise against using both at the same time. But if you do, you want to consume a smaller amount of the marijuana, because whatever marijuana you do take, because it's the alcohol's just, or the liver's just worried about the alcohol, it's going to stick around in your system longer. That it's all theory based, but like I said, clinically, what we're seeing is that it keeps the amounts of the marijuana elevated, and that's one of the theories as to why that may be going on.
Sure, sure. Well, and especially knowing that alcohol is a toxin essentially that's taxing the liver, and at least with medicinal marijuana, it's having health benefits. So,
Yeah. And as far as we know, there are no toxic metabolites produced from the marijuana.
that's also fantastic to know. Now, I'm looking again at your blog, and you've got an article about what are cannabinoids. I know we've sort of been talking about them, but
Sure.
we didn't really address what are cannabinoids.
So cannabinoids are basically an umbrella term for the different chemicals made by marijuana. So I mentioned CBD, I mentioned THC. Those are 2 of the many. Probably, at this point, they're guessing 60 to 100 different chemical compounds that are made in the plant. And we know of two. And as far as we know, those are the two that are made in abundance by the plant. And they're, the other ones, the other 60 to 100 compounds, they're not necessarily separate compounds. They could be compounds that are precursors to the CBD. So we know that there's THCA and there's CBDA. They're both acids. And when you apply heat to the plant, whether it's in the form of UV light or direct heat, it then what's called decarboxylates the acids and turns them into CBD and THC. So that's a general term. All of the different chemicals are known as cannabinoids.
And you have an article which goes along with what you just said that talks about how our bodies make the same chemicals as marijuana.
Yes. So we have several different chemicals in our body, but the one that we know the most about is this chemical called anandamide. And the root of the word is very interesting. So ananda in Sanskrit means bliss. So I'm sure it comes from the fact that THC causes this, euphoric effect, and they found a chemical in the body that's very similar to the THC, so they decided to call it anandamide.
I wonder if that's why we have so many health benefits from it, is because the chemicals are so closely related to what we do. Have you seen any other plants in nature that that are as medicinal as marijuana, like that have all these other components that do all these other wonderful things?
Growing up in a household, so being Indian, Ayurvedic medicine, which is traditional Indian medicine, is pretty much something that's a part of everyday life in the Indian culture. So I know that the plants were incorporated as medicine on an everyday basis growing up. So, for instance, my cousin, he got a cut in his toe from kicking a soccer ball. Actually, it was a pretty deep gash. And so right away, what my grandma did was she stuffed the cut with turmeric. And the reason she did that is that turmeric has antimicrobial properties as well as anti-inflammatory properties. So I'm sure they do. It's hard to compare. And I don't have much of a background in botany, so it's hard for me to give you a good answer to that question.
I loved what your grandmother did with turmeric. I'm going to remember that when my son gets a gash.
Yeah.
That's awesome. Now, I know we've already talked about why it's important to make sure we purchase, or as a patient purchases their marijuana that has been tested by a lab. I see that you have a great blog post on your website about the 5 reasons why you don't want to buy marijuana off the streets. For those people who are suffering from these pro-inflammatory conditions or conditions of great pain, but they don't live in a state where they can gain access to medical marijuana, what do you recommend they do?
Well, one of the possibilities is to use marijuana doesn't come in prescription form. Marinol is the most common one. That's the brand name, and then the generic name is dronabinol. Now, it's basically what it is that it's a synthetic THC. So basically this molecule that was created in a lab. So it doesn't come from a plant. It doesn't come from our own body. It's a synthetic version. And also it's just the isolated synthetic version. You don't have any of the other chemicals that are in marijuana. So that is a possibility to get, a prescription for that. I do know that there is a pharmaceutical company, GW Pharma, that's starting to create pharmaceutical medications that are derived from the plant, but unfortunately they're not approved for use in the United States. Although I do believe it is approved for use in Canada. It's called Sativex. So that may be something to look into for your Canadian listeners.
Oh, fantastic. Excellent.
Yeah.
And I'm on your website, and the link to your website is going to be in the show notes of the podcast. But the website essentially is Dr. for doctor, Rachna Patel.com, and that's DRRCHNA RACHNAPATEL.com. Looking at the types of conditions that you treat, and you have this long list. What jumped out at me is migraines, and I know several people who've suffered from migraines, and nothing has helped them. No drugs have helped them, and they're debilitating. What's your track record with helping women or helping people overcome migraines to the point where do they no longer have them because of medical marijuana, or do they only take the medical marijuana during that migraine to mitigate the symptoms?
So all of the above. I've had patients where they've used medical marijuana, and they'll come back to me a year later, and I'll ask them, when was your last headache? And they'll say, honestly, I don't remember when I had my last headache. It must have been a while ago. Then I have other patients who the frequency of their migraines goes down. So if they had them like once a week, it's down to once every 3 to 4 months. Then I have other patients where it helps to reduce the severity of the migraines and the duration of the migraines. So when they get the migraine, they'll go ahead and take the medical marijuana, and within an hour or two, the migraine has resolved. The most common alternative, not the most common alternative, but the most common class of pharmaceutical medications used for migraines are called triptans. Now, the downside of the triptans is that you have to catch the migraine at just the right time. And if you don't, then you have to continue to bear through the migraine. So one of the advantages of the medical marijuana is that you can take it at any point. You don't have to catch it at the right time. So I found that it's the full gamut. I've had patients that have completely, the migraines are gone. And then I've had other patients where it's helped to reduce the frequency. And then other patients where it helps to reduce the severity and the duration of the migraines. So it ranges.
And for parents who have children with maybe ADHD or anxiety or sleep problems, or maybe not so severe issues like epilepsy or cancer, have you been able to help children overcome these lesser problems without the with CBD, for example, that doesn't cause psychoactive responses? Have you worked with children in helping them to find health?
Yeah. So, the most common scenario I get is the adolescent that has been, quote unquote, self-medicating with marijuana off the streets. And then the parents find out and confront them. And, these adolescents end up telling their parents that, hey, I'm using it because it's helping me. It helps me focus. It helps me with my anxiety. It helps me sleep. So then eventually the parents bring their kids to my office, and they're like, okay, we know that he or she is using it. We just want to make sure they're using it in the right way. And so, yes, I have found that it helps. Now, with conditions like anxiety, with sleep, specifically with anxiety, I found that it's typically the higher CBDs that help. With difficulty sleeping, it really varies, the combination of chemicals on the severity. I found that I have to treat my mild to moderate insomniacs much more differently than my moderate to severe insomniacs. And then with ADHD, that's more of a subjective outcome because it's more long term. Generally, my patients do report back to me that it does help them to concentrate and to focus. Those are the specific words that they use when they report results back to me.
Fantastic. Now, let's say a listener's in the state of California and they want to come see you. Kind of walk us through, what does it look like to be your patient? So I'm a brand new patient, and I'm booking an appointment with you. Walk me through what it looks like.
Sure. So it's just like any other doctor's appointment. You come in, you fill out some paperwork, and then we sit down together. I take a pretty thorough history, and then I do a brief physical exam. And then what I do is I specifically walk you through step by step how you're supposed to be using medical marijuana for your specific conditions. And that's pretty much the process.
Do you require that people bring you labs or tests, or do you order labs or tests?
No, I don't order any labs or tests, nor do I require them. It's more on a case-by-case basis. It's always good to see medical records, but I don't necessarily always require them.
Okay, fantastic. And what are some common questions that you get, and that we haven't discussed yet today?
Actually, one of the other things I wanted to discuss was colitis. That's definitely one of the other inflammatory conditions that medical marijuana helps a lot with. And I wanted to delve just a little bit into the science of it.
Oh, great.
So what we do know is that there are these receptors called cannabinoid receptors that are cannabinoid receptors. Basically, what they are the conduit that helps marijuana interact with your cell. Okay. So we need them. They're necessary. And we found that the human ileum and the colon actually expresses cannabinoid receptors. And when there is significant inflammation, the number of these receptors actually goes up. So that's pretty significant in that the body's saying, okay, I'm creating more of these receptors because I want to work on reducing the inflammation, so I need more cannabinoids to interact with all these receptors that I've created. And that's pretty much about it. And I mean, in humans, there's also been research done in mice where naturally this chemical that I was talking about, anandamide. So when there's what happens is that when you prevent the breakdown of anandamide, the levels of inflammation in mice with colitis significantly went down. So even that chemical in our own bodies, and that actually also happens to be made in mice, plays a role in helping to reduce inflammation.
That's amazing. And for those who don't know what colitis is, explain a little bit about that. Maybe some people have the symptoms and don't realize they have colitis. So what are the symptoms? What's colitis?
Sure. So basically, it's an inflammation of your bowels, your small intestine, mainly your large intestine. And the diagnostic terms for these are ulcerative colitis, Crohn's disease, and they can be associated with symptoms like abdominal pain, cramping. You can get bouts of diarrhea, bouts of constipation. You can get rectal bleeding from them. A lot of times your appetite's poor. You can get nausea from them as well. So there's a whole slew of symptoms that are associated with inflammation of the colon.
And for those who have those symptoms but haven't been diagnosed, maybe they think they have irritable bowel syndrome, or they have intermittent constipation, diarrhea. So they have something going on in their gut, something somewhere, and they had pain and indigestion. Have people come to you at that point, so without a diagnosis, and seen positive results using medicinal marijuana?
So the point at which I see patients is when the diagnosis has been made and they've sort of spun their wheels with, pharmaceutical treatments, over-the-counter treatments, even some alternative treatments, and then they'll actually come to me. So I haven't seen patients specifically when it comes to irritable bowel or inflammatory bowel that haven't really been diagnosed. And quite frankly, I wouldn't feel comfortable starting them off on medical marijuana. I don't want to use medical marijuana as just sort of a patch, to cover up a symptom. It is important to know what the underlying cause is before you sort of just cover up the symptom, because what we don't want is for the condition to get worse and worse.
Yes, I absolutely agree. Get to the root cause, because they might need to change their diet. They might need to change their medications. Absolutely. For those who find themselves to be generally healthy, like maybe they have little itsy bitsy problems, but nothing on the grand scale that we've been talking about. Do you ever see patients, for example, they want to do weight loss, or like they want to achieve something that's less immediate in terms of like the severity, like something like pain? Have you worked with someone who wanted to like lose weight with marijuana, or maybe wanted to just seek the health benefits and they didn't have a major issue?
I haven't. Most patients, actually all patients that I see have been diagnosed with some sort of condition. And it also is in line with, rules and regulations in the state of California, that it's I'm recommending it specifically for medical reasons.
Right.
So I haven't really seen patients along those lines. Now, specifically when it comes to weight loss, I haven't really found overall any sort of effect long-term on weight from my patients that have been using medical marijuana on a regular basis. So, yeah. So yeah, in terms of clinical outcomes, I haven't seen much in the way of weight loss.
Right, that's good to know, because I mean I've heard people say, "Oh yeah, it's great for weight loss," and in my mind, people just get the munchies. But, and also, when I think in the past, when I thought of a medical marijuana doctor, I kind of thought of, oh yeah, those people just want a card to get high. They just want to get marijuana, legally, and so they're just going to go to some doctor that's not going to really, they're just going to write them anything. Anyone can pay money and get a card. And what you're saying is that you're a legitimate doctor, you're legitimately helping the patients, and these patients legitimately are need something. They've gone through the system, and it's not working anymore, or the medications or what they're doing isn't working, and they come to you and you get results.
Yeah, that's pretty much it. And there's no doubt that there are recreational users out there, but the patients that I see day in and day out are the patients that are specifically looking to use medical marijuana for medical reasons. They're not looking to get any sort of the effects like the high, for instance. So yeah, that's mainly what you described is mainly the patient population that comes to me.
Fantastic. Excellent. And then I see that you talk about back pain on your website, and that's something I know so many people who have back pain. Is that something where you found that tincture, the topicals alone can help with the chronic back pain, or is that still case by case?
Yeah, it is case by case. Now, this is what I found. I found that topicals, if the pain is nerve related, I found that topicals don't work as well in relieving the pain. If the pain is either skeletal or muscular in nature, then I have found that the topicals work well. But also, topicals you have to take into account from a practical perspective as well, right? So if you have many layers of tissue over, like a hip that's arthritic, it's going to be very difficult for the topical to penetrate all that tissue and be effective in relieving the pain. So yes, it is case by case. It just depends where you're having the pain, what's causing the pain. And based on that is how I advise patients on, okay, well, this method will be best for this particular condition that you have, or this method would be best for this particular condition that you have.
And now you have an email sign up on your website that I sign up for it. I recommend that my listeners do as well. When they go to your website, there's a big red button that says sign up now. So it's a free email where you send some great information, like I'm worried about addiction is one of the things that you talk about. And then you also talk about, hey, the last time I used marijuana was in college and I felt really paranoid, and I'm concerned about this, or I don't want to gain weight from marijuana, which I think everyone just gets the munchies and gains weight, but probably not when you do it dosed based how you explain it. So they're going to get lots of great information from signing up for your email list. But could you teach us now, what about the people who are worried about addiction? What do you say to them?
Sure. So addiction, I always like to sort of use alcohol as an analogy. Okay. So for someone that's been using, drinking wine, a glass of wine a night, they're likely not going to get addicted to alcohol. Now, if you've been drinking like a case of beer a night, yes, the likelihood is higher that you'll get addicted. So a lot of it there is a potential for addiction with marijuana based on research. And to put it into perspective, opioid use, okay, and first of all, the potential for addiction is when they're talking about heavy users, people who are using excessive amounts of it. So for opioid users, so these are patients that are taking like Vicodin, Norco, Percocet, etc. It's about a 16% chance of addiction. With alcohol, it's about a 32% chance. With marijuana, it's about a 9% chance. Those are the approximate numbers.
Wow.
But so one is so a lot of it comes down to how you're using it, right? And I believe in minimal, first of all, using the right combination of chemicals. Secondly, using the minimal absolute possible dose that you need, and then using it with a minimal frequency. And what a lot of people don't realize is that you don't have to use marijuana on an everyday basis. And that's because it's a fat-soluble medication. You have stores of it in your fat cells. And so even on the days that you're not using it, it's still available to your body to help your symptoms. So that's kind of the big picture that you need to take into account when it comes to addiction.
Amazing. So how many days I know it probably is case by case, but how many days would someone go in between doses? What have you seen be like an effective amount of effective duration?
So again, it varies. Back to what I said before on metabolism of how you metabolize fats. So on average, I found patients need to use it like 1 to 3 times a week. But I've also had patients that can cut down to once every other week, once every 2 weeks. So it really depends.
Wow, that's incredibly low doses.
Yeah. Mm-hmm. Yep.
That's fantastic. I mean, I think of things like homeopathy, where it's virtually, there's almost nothing within the medicine itself, and yet it works. So it's like this idea of the minimalistic amount of medication having the most effect.
Yep. Yeah.
That's
and in fact, what can happen is that if you overdo the marijuana, you can develop a tolerance to it, and then it's not as effective.
Is it not as effective as like medicinally, like as a anti-inflammatory and all the other healing properties?
Yeah. So what happens is that, so scientifically what's going on is that you have receptor downregulation going on. When you expose your body to too much marijuana, the body makes less receptors. So in colitis, I talked about how the body made more receptors, but now it's making less receptors because it's being overexposed to marijuana. And so then your cells the marijuana is not having the same effect on your cells because there's fewer receptors to help the marijuana interact with the cells. So if you overdo it, yeah, you do get receptor downregulation.
And for those, have you had patients come to you that were already taking marijuana that were taking way too much, and they came to you and you helped them to find that proper dose?
Yes, absolutely.
And
yeah,
so,
I was able to help them cut down on their use, and they learned that they didn't need to use it as often as they were using it.
I mean, I know there's, especially in the state of Washington where it's now legal and anyone can buy it who's 21 and over. I'm sure people are not using the correct dose. I mean, because there's not exactly instructions on the package. So.
Yeah, and the instructions on the package, they're arbitrary and not necessarily based on science. So I have no idea how they're going about coming up with these serving sizes. And oftentimes I find that it's too much what they listed on the packaging.
I just don't know anything about this, but when it comes to edibles or tinctures, would it say like how many milligrams is in it?
Here. I have an empty box in front of me. So let me read you what this box says. it says consumption advice, and it says until you know and this is a chocolate bar, okay, probably scored into squares. So this box says consumption advice: until you know the effect of this product, eat only half of one segment and wait a minimum of 1 hour before consuming another segment. Now, half of one segment for one patient could be way too much. So where they came up with that half a segment, I don't know. So I usually teach my patients how to figure out dosing, but like I said, it does vary from patient to patient.
What kind of advice would you give someone who has been using, either from the street or buying it themselves, and they want to dial down and get to the right dose? What's your advice for those kind of people?
That's going to really, it would be important for me to take the whole picture into account, like what they're using it for, how often they're already using it, what combination of chemicals. So it's hard for me to just generalize in that sense.
Got it. Well,
yeah.
It just seems like we could learn so much from you. Before we wrap things up today, do you have any other bits of advice or information you'd love to share?
No, not at this point, but like I said before, your listeners are more than welcome to ask me any questions that they have on my Facebook page, and I will try my best to answer them.
Excellent. And you have great videos. You've got a YouTube channel with some fantastic videos, some great information. The link to that's going to be in the show notes as well. I urge my listeners who are interested in learning more about the health benefits of medicinal marijuana to check out your website, read your blog, check out your email list where you send some great information. I love that you're putting yourself out there and helping everyone on Ask Anything Wednesday that's on your Facebook page. That's fantastic. I know you're specifically a medicinal marijuana expert. I like to ask my guests to challenge my listeners to something that would improve their health. What could you challenge my listeners that they could do now and for the next 7 days to improve their health?
Sure. I would say think of marijuana in a different light. That when used appropriately and responsibly, it can serve as a fantastic medication.
I love it. Excellent. We have to definitely examine where we came up with our belief systems, because I think we inherited so many belief systems from our parents and our grandparents, from our family, from society, without questioning it.
Politicians with agendas.
Exactly, right, yes. And we need to question our own belief system and decide for ourselves what is right, what is wrong, instead of looking at the world so black and white. I know so many people are think that marijuana is as bad as heroin. I know when I was in junior high, they were teaching, drug awareness, and they put pot in the same category as heroin. And my mom, who was like a hippie, reborn hippie, I came home crying, thinking my mom was going to overdose and kill herself, because I knew that she did it recreationally, and so I was, even though I saw my mom and I was raised, seeing that it was harmless. I was still taught, I was still very, I was still brought up believing how bad it was, because my teacher told me it was bad, so it must be bad. And now seeing that, I have a friend with Tourette's who has almost debilitating Tourette's, where several times in a conversation it's interrupted by yelling, and when he takes in CBD, he's adamantly does not smoke pot, does not smoke or take in any of the THC, take in any of the psychoactive ingredients. But when he does CBD, his Tourette's goes away. And to see his quality of life go up because of that. And I've seen other friends whose quality of life has improved so much from this plant. My my world has really opened. My mind is open, and so I urge listeners to open their mind. And I guess if they've been listening to this episode the entire time, their mind is probably open by now. But please definitely check out Dr. Patel's website and information. And thank you so much for sharing this. I'd love for you to come back on the show one day, especially if you have more clinical research that you'd like to share. You're welcome to come back on the show.
Thank you so much for having me. I appreciate it.
It's been fantastic. Are you looking to optimize your health? Are you looking to get the best supplements at the lowest price? For high quality supplements and to talk to someone about what supplements are best for you, go to takeyoursupplements.com, and one of our fantastic True Health coaches will help you pick out the right supplements for you that are the highest quality and the best price. That's takeyoursupplements.com. takeyoursupplements.com. That's takeyoursupplements.com. Be sure to ask about free shipping and our awesome referral program.